Gatuzi la Isiolo limezindua rasmi kampeni ya siku 16 za uhamasishaji dhidi ya ukatili wa kijinsia mwaka 2025 katika uwanja wa hospitali ya rufaa ya Isiolo. Wakihutubia waandishi wa habari baada ya uzinduzi huo, wadau waliodai shughuli hii wakiongozwa na SHAP, Transparency International na serikali ya kaunti ya Isiolo wamesema kuwa visa vya ukatili wa kijinsia vinazidi kuongezeka, hususan ukatili wa kidijitali unaolenga wanawake na wasichana. Wameitaka jamii kuongeza uelewa, kutoa mafunzo ya usalama mtandaoni na kuimarisha ushirikiano wa taasisi mbalimbali katika kukabiliana na changamoto hizi.
Dorothy Okemo, and I'm the coordinator of the SHAP project. The SHAP project is really about providing solutions to support healthy adolescents. It's a project that is being implemented in Isiolo, Marsabit, Mandera, and 5 other Great Lakes region countries. And of course, as we launch the 16 days of activism today, the adolescent is really at the heart of what we intend to do. Particularly when you look at the issue of the triple threat, teenage pregnancy, new HIV infection, and SGBV, we certainly need to have interventions that are really targeting adolescents and teenagers. And that is why SHAP is actually in this county to not only work with the health department in terms of enhancing multi-sectoral collaboration, because when you look at issues of SGBV, they touch directly on the gender department and on the health department. And so for us to be able to slay this monster of teenage pregnancy, we must work together. We must enhance that collaboration. We have to work with the grassroots organizations at community level. So one of the things that we are planning to do around these 16 days is to support and collaborate with CSOs working across all the sub-counties in this Isiolo County in terms of having dialogues and sensitization forums. And these are activities we are planning jointly with the Department of Health so that we can sensitize them on issues of teenage pregnancy, on accessing the relevant information, and on the referral pathways, because policies and guidelines are only as important as the people who are aware about those. The other thing we are doing is having high-level engagements with policymakers so that we can get real commitment in terms of what we can implement in terms of rapid action towards elimination of violence and the issue of triple threat. Of course, the other thing is supporting issues of data quality, because without data, it is impossible to, plan accordingly. And so what we want to do is really support the department to do data quality management and assurance so that they can make informed decisions as a result of this. Yes.
Do you feel this year's theme is timely and why?
This year's theme is extremely timely because we know most of our youth, not even most, all of our youth are actually engaged in the digital space. They are the biggest victims of cyberbullying, of body shaming, and all forms of abuse that are happening in the digital space. I know there's even a new trend of a lot of suicide cases, particularly among boys. And so the theme for this year is extremely timely. And that is why we have to really take this opportunity to work with other like-minded organizations, particularly the youth-led organizations, to do a lot of peer education and sensitization, and to really bring to an end the issue of digital violence and the issue of cyberbullying for the sake of our adolescents and young people, because they certainly are the future of this nation.
My name is Dr. Mohammed Abdikadir. I'm the Chief Officer of Health Services, Isiolo County. And today we are very happy to have hosted this day of fighting with the GBV. And as a county government, we are ready to engage on those people who are bringing violence to our women and our mothers. So, as we've said, there's a group, there's a family called Streetwood family in this town. These are the people who are very vulnerable and they are prone to all sorts of violence, be it sexual, rape cases, and all these kind of violences. As county government, we are ready to assist them. Whatever issues they get in terms of diseases, in terms of the complications, our hospital is ready to handle their cases. And besides that, the other people, wale wanaishi within the county, those ones who cannot afford to pay for their fees, if they are harassed, they come to the hospital, they have to pay either postmortem fees or P3 fees. Those ones we are going to waive them. We'll send them through our waiver process and we'll waive them, and we'll make sure that their haki yao haitapotea. And we talked about rehabilitation, because most of our young boys or young men who involve themselves in drugs, they need to be assisted. So in doing so, we said we are going to, as a county, we are going to construct a rehabilitation center which is going to serve all of them and at least make sure that they are reformed. Hii ni wakati wa likizo, wakati ya likizo refu wa Disemba. Kutakuwa na mvua mingi, kutakuwa na maziwa nyingi, na watu wakati huu ndio wanachukua nafasi hii ya kufanya hiyo circumcision ya wanaume na pia ya wasichana. Sasa sisi kama county government tukishirikiana na serikali kuu tutakuwa macho kuhakikisha kwamba wasichana hawezi kufanyiwa hiyo circumcision. Na wale kwa bahati mbaya tutawapata, tuko na team ambayo watatusaidia kwa upande ya kuhakikisha kwamba tuko na evidence ya kwamba umeumizwa, na watasimama kotini na yule ambaye ameleta hiyo maneno, na tutahakikisha kwamba mtoto msichana ama mama amepata haki yake.
To the GBV service providers. So I think that is where we get the data as a county, and our GBV department also has data, although I cannot disclose, of various cases that we've had.
As a county government, we are prepared to inform our people how to stop these vices. We'll go to the radio stations, we'll go to the mosque, we'll go to the churches, and everywhere in the public barazas. We'll make sure that people are informed, well informed about these vices, so that they cannot take part in doing this criminal act. And for those ones who are affected by maybe teenage pregnancies or early marriages, we have counselors and psychologists in the hospital who can talk to them and just give them chance in life that they can still be helped.
Pia wamehimiza wananchi kuripoti visa vya ukatili mara moja, na wameahidi kutumia siku 16 kuhamasisha jamii ili kupigana na kukomesha vitendo hivyo.
And our theme this year is to end all forms of digital violence against women. Digital violence trickles down from stalking to surveillance and all forms of control online. And whether it's online or offline, digital violence and all forms of violence are actually, there is no excuse to that. Isiolo County Government is actually making efforts to actually reduce the number of gender-based violence cases. First of all, together with other partners, we have been able to start one-stop centers in various facilities. We are also starting to do our GIS maps for various health facilities. And also next year in February, we're going to launch our directory, our GBV directory, that will be able to link our survivors to the GBV service providers. FGM is still an illegal act in Kenya. So medicalization is even more illegal, because once a healthcare practitioner that actually is actually given the medical ethics on how to perform with patients goes and medicalizes FGM, it is actually very detrimental to the health of the woman or the girl that is facing the FGM. So for Isiolo County, we've not had any cases, I think so far, of medicalization, maybe the ones that have come to the hospital. but it's something that our department is very keen to observe, that no one under our health department actually goes and does such practices behind our backs, either privately or in a public hospital. Online, but it's something that can actually cascade to be also offline, because it's the stalking, it's the harsh comments, it's the, you know, the bad images of people that are traded online. And also this, as we said, there's also a lot of sex trafficking and human trafficking going on online. So digital violence is something that is not only online, is not restricted to be online. It's something that can actually be seen in day-to-day life. It can come out and be in the actual world. And as I said earlier, whether it's offline or online, there is no excuse for gender-based violence.
Kauli mbiu ya mwaka huu inalenga kukomesha ukatili wa kidijitali dhidi ya wanawake na wasichana, ikisisitiza usalama wa maeneo ya mtandaoni, matumizi bora ya teknolojia na ulinzi wa waathiriwa.
My name is Lotaruk Nahashon. I work with the National Gender and Equality Commission as a regional coordinator for the Upper Eastern Regional Office. On that question on coordination, as a state agency mandated to promote gender equality and non-discrimination in Kenya, our role is actually to look at all the programs that relate to those we call the special interest groups. And when we talk about the special interest groups, we are talking about our women, we are talking about persons with disabilities, we are talking about the minorities and the marginalized, we are talking about children and our youth. And also, as a commission, our major role in the counties is actually to try as much as possible to strengthen the existing structures. And when we look at strengthening, we look at all the programs pertaining to those the special interest groups. And in that, in Isiolo here, we have coordination structures already in place, like the Gender Technical Working Group. And as a commission, our role is actually to bring all the state and the non-state actors together, so that we can be able to tackle some of the issues that pertain to those particular groups in our communities. And in that, the way we try as much as possible to strengthen the coordination mechanisms between the development partners is actually, one, to strengthen the county gender technical working group, then try to cascade it now to the sub-counties. So we want to, maybe in the next few years, we want to see how we can have stronger sub-county gender technical working groups. Then again, we can have ward technical working groups. Then we can be able now to strengthen the coordination mechanism. And in that, I'll also want to mention something on GBV. When we look at coordination in terms of the partnerships in gender-based violence, we look at what are these programs that many development partners are running, and how can we bring all of them together so that we can have a coordinated kind of working mechanism between all of them, so that they don't work in silos, in the coordination of their services. So we are trying as much as possible to see how we can, bring all the development partners and governments together. And in this case, we have developed what we call the County Referral Pathway. County Referral Pathway for GBV, it's a coordinated mechanism on how all of us as state actors and the non-state actors or the development partners, how we can be able to coordinate the services that are offered to these survivors of gender-based violence. So we already have a referral pathway in place for this county, and we want to see how we can further bring in so many other development partners who can offer so many other services. We have services that we know we have a few gaps in terms of psychosocial support, and it's good that the Ministry of Health is coming in handy to support us, especially on the prevention, in the response mechanism. And you've heard about the Gender Violence Recovery Center. We want to see how we can also have a response mechanism in terms of having a safe space for Isiolo County. So I think that is all how we want to ensure how the coordinated, how we can have a better coordinated mechanism for Isiolo. Thank you. That is one. Then secondly, we want also to step up sensitization and public education across the sub-counties. And that one we want also to ride on some other days that are ahead. You know, we have the International Day for Persons with Disabilities on 3rd of December. We will ride on the same day just to continue with this conversation, because mostly when you talk about GBV, we have categories of the special interest groups that suffer more, and those are persons with disabilities. If it happens to a person with disability, it is even more double in terms of the consequences that happen.
Tukio hilo liliongozwa na naibu kamishna wa kaunti ya Isiolo Edwin Kuria kwa niaba ya kamishna wa gatuzi hili David Kiprop.
Kuwa pia ongezefu wa ile maneno Mr. Karioke alituelezea, wamama wanauliwa, wasichana wanauliwa, na hawauliwi na watu wengine, ni sisi wanaume tu, mandugu wao, mababa wao ambao tunafanya hizo vitendo. Ukifuatilia zamani, hiyo maneno haikuwa inafanyika. Tunafaa tujiulize vizuri sana, why are these issues coming up now? Now what is it that we are doing differently? Is it school? Is it the family? Where has broken down? Tunafaa kuangalia sana hiyo maneno. Kwa hiyo maneno tu Mr. Karioke aliongezea, kuna maneno inaendelea na inanyamaziwa sana. Wazee wanadhulumiwa na hakuna mtu anaongea. Mambo ya watoto tumejaribu kuchukua hatua fulani. When I was a DO in Makueni County, tulikuwa na magistrate alikuwa anafunga watu miaka 30, lakini nikuchekeshe, hiyo maneno bado inaendelea huko. Kwa hivyo kifungo mrefu pekee haisaidii, lazima tuingize vitu zingine, mambo ya creation of awareness, mambo ya counseling kwa hawa watu ambao wako na mental issues. Lazima we attack this problem with every tool that we have at our disposal. Hapo najua ndio imekuwa weak link. Alafu pia kuna stigma sana, watu wanakataa kuongea hii maneno. I'm happy that we have started 16 days of activism, na ninaomba hizo siku 16 kila siku tusikie sauti yenu pahali muko.
Bundi Eric Meme from the Ministry of Education. We are here today to celebrate or to start the 16 days of activism, na ningetaka kuzungumzia tu mambo ya digital form of GBV ambayo hapa Isiolo imetuadhiri sana, kwa sababu wale wasichana wetu wanakutana na watu kwa mitandao, wanafanya ndoa ama wengine wanatoroshwa kupitia kwa hii mitandao. Hii inatusumbua sana kwa sababu wanatoroka kwa shule na wanaweza kutolewa nje ya nchi. So nataka kusema tu kwa kifupi kwamba tujaribu sana kuelimisha wananchi wa Isiolo ili waweze kupambana na hii jambo ambalo ni lipya, jambo ambalo alikuwa mbeleni la mambo ya mitandao. Watoto wetu wanapotoshwa kwa kutumia simu za bei ghali, kutumia pesa, na mara nyingine wazazi wetu pia wanahusika. So yangu ni hayo tu, kuwashukuru sana na kuomba watu waendelee na hii 16 days of activism.
Kuna mambo yafuatayo ambayo tumegundua kama idara ya gender, idara ya jinsia, na tujue idara ya jinsia sio mambo ya akina mama. Kuna mwingine aliniita ofisa wa akina mama. Sio akina mama peke yao, gender is everybody. Ni wazee pia. Tumegundua Isiolo wazee wanatandikwa na wananyamaza. They are also victims. Watoto vile vile na akina mama. Ama hamuchapi wazee wenu? Hawa hawachapwi? Wanachapwa. Nimesikia mwingine akisema wanachapwa. Ni kunyamaza, wananyamaza tu, lakini tunajua. Wanakuja kwa ofisi zetu kutuambia walichapwa. Kwa hivyo challenge ya kwanza, tuna shida ya full-fledged rescue center. Hapa Isiolo hatuna rescue center, hatuna. Na hilo jambo Profesa Bishop amelisema mikutano yote, hata tulipokuwa na ngek mkahawa fulani uko pale, alisema hatuna rescue center. Wafadhili tunahitaji tukuje pamoja, serikali na mashirika yote, tuone what we can do so that this period should be different, ili msimu huu wa activism wa wana harakati ukuwe tofauti. Mkuje pamoja, we cannot sing this throughout. We need to do something. We should be like the hummingbird ambayo ilisema hata kama msitu ni mkubwa, there is something little that I can do. Kuna jambo kidogo ninaweza kufanya. It is your little effort na our little effort as government that will bring a change. Kwa hivyo tunahitaji kuketi sisi members wa technical working group tuweze kuona what we can do, ili tuseme during this season of 16 days of activism 2025 tuliweza kuanza something, kutumia pesa za wafadhili kama UNICEF, World Vision, alafu policy ikimalizika tunaiweka kwa shelf. Let us think on how, na hii ni vizuri uandike, because we shall take up some of these things. So implementation of the policies in the gender space.
Nikiripotia Kamachu TV, itaripota 001 wa Chumbi Kamachu.